Hello everyone, welcome to Rise IS. I am Alok Bardhan, and in today's deep analysis session, we will discuss a very important article from today's The Hindu newspaper on India's public health and nutrition. So, title of today's article is How Schools Can Tackle Adolescent Malnutrition. So, let's see what this article mainly discussed. So, this article mainly discussed about the recent finding of National Family Health Survey 6 and how India is facing dual burden of malnutrition, which is which is called obesity and malnutrition. And this article also discussed why Indian malnutrition case is unique because due to thin fat phenotype. And this article discussed the key data and facts about health, undernutrition, and malnutrition. This article also discussed a way to tackle the situation or crisis, to including milk, dairy product, and green vegetables in our diet, and what is the key guidelines to take from government of India to tackle this situation, and why we should why we should reduce the use of sugar and ultra processed food to tackle such kind of situation, and why health factor due to non-communicable disease is the r- region of major region of death among children and high disease burden. And this article also discussed about how schools can play a role in inculcating in, inculcating good dietary habit and good nutrition information amongst children. And also this article lastly discussed about recent finding of Lancet and how we can tackle this situation. So let's start our discussion with PYQs. So you can ask why this article important, why we should read this article. Because as you can see, this article discussed major health related data and key information about health and nutrition. And health and nutrition is a very important theme for upcoming men's examination due to, and why we are saying this, we are saying this mainly because UPSC in 2024 itself asked a question on health and health and malnutrition. So and the question was, poverty and malnutrition create a vicious cycle adversely affecting human capital formation. What steps can be taken to break the cycle? So as you can see, issue related to poverty and malnutrition is a central theme of UPSC. UPSC asked continuously asking questions from this theme. So please read this article very carefully. We have highlighted the most important point of this article for better better understanding of article. And after reading this article or attending this session, please attempt this PYQ. This this can boost this can give boost to your preparation. So let's start our today's discussion with context of this article. So recent health data show a sharp rise in obesity and high blood sugar across urban and rural India. So why this is a sign of concern? Because this is a concern because earlier it obesity and high blood sugar type of health related disease limited to urban area, but nowadays due to penetration of ultra processed food in rural area, this this become a key concern also in rural area. So alongside persistent childhood undernutrition reflect a dual burden of malnutrition. So what is dual burden of malnutrition? A dual burden of malnutrition reflect lifestyle disease begin in adolescent school have become the most effective platform for early prevention. So what is dual burden of malnutrition? So dual burden of malnutrition is high high malnutrition or undernutrition and high obesity. So high malnutrition or high undernutrition and high obesity result the dual burden of malnutrition. This is due to lifestyle design due to change lifestyle design changes which begins from adolescent school. So school becomes the most effective platform for early prevention or give early warning or inculcating good habit for better life. So to start with, India's malnutrition has evolved into thin fat phenotype. So what is this thin fat phenotype? Thin fat phenotype because children appears lean but have high metabolic risk due to consumption of high ultra processed food. Schools must function as a center of preventive healthcare by promoting healthy nutrition and lifestyle to curb diet related non communicable diseases before they become major public health crisis. So before this health related issue can become major public health crisis, schools must intervene in inculcating good dietary habit among students and promote usage of green vegetables and dairy products. So let's see some key global statistics and global context of this article. So according to Global Hunger Index, India ranked 102 out of 123 country under, and India comes under serious hunger category. So this is this is this is a concerning phenomena because India ranked 102 amongst 123 country and India placed under serious hunger category. According to National Family Health Survey 6, which occurred in 2023-24, obesity in India increased to 30.7% among women aged between 15 to 49 years and 27.3% among men, and due to this also result to and high blood sugar and obesity amongst Indian population. What is the World Health Organization saying about this? World Health Organization warned ultra processed food consumption is increased in India by 13.7%. So, according to WHO, ultra processed food consumption increased in India by 13.7%. What Lancet said about it? Lancet said by 2050, India may have 21.8 crore overweight and 23.1 crore and overweight women if we did not intervene in time. So, according to Lancet, by 2050, India may have 21.8 crore overweight men and 23.1 crore overweight women. So, this needs urgent intervention. So, let's see let's see what is malnutrition. So, malnutrition refer to imbalance in nutrient intake and include undernutrition, which include wasting, stunting, underweight, macronutrient deficiency. And another such type of malnutrition is overnutrition. So, overweight, obesity, diet-related non-communicable diseases. So, there are two type of malnutrition. So, malnutrition can be simply described as imbalance of nutrient intake, and this include undernutrition. In undernutrition section, we can place wasting, stunting, and underweight, and micronutrient deficiency. And in overnutrition, we can say overweight, obesity, and diet-related non-communicable diseases can be placed in overnutrition. Now, let's see about type of malnutrition. So, first one is undernutrition. So, on first concept is wasting. So, low weight to height due to inadequate food or infection is called wasting. And Low height for age caused by due to chronic undernutrition can be called as stunting, and low weight for age may include wasting, stunting, or both can be called underweight. So let's see about macronutrient related malnutrition. So first one is vitamin A deficiency. So due to vitamin A deficiency, vision impairment and weak immunity can be occur. And what about iron deficiency? Iron deficiency lead to anemia, fatigue, and weakness. And due to iodine deficiency, thyroid disease, thyroid disorder, and poor cognitive development can occur. Now let's see about obesity and overweight. So obesity and overweight caused by excess calorie intake and sedentary lifestyle. So when is less body mass index is over 25 can be called overweight, and when it is over 30 it's called obesity. Then obesity and overweight can cause diet related non-communicable diseases, and it includes cardiovascular disease, diabetes, stroke, hypertension. These kind of disease can occur from unhealthy lifestyle and unhealthy diets. So what is the core causes behind malnutrition? So poverty and food insecurity, because around 74% of Indians cannot afford healthy diet. So healthy diet and completing daily protein requirement becomes very mm, very unaffordable for most of the people, and around 74% of the Indians cannot afford a healthy diet. Second one is rising consumption of high fat, sugar, and salt food and ultra processed food is a so due to recent changing diet and high consumption of high fat, sugar and salt and usage of ultra processed food is another core cause behind this malnutrition. Next one is poor sanitation and wash. So limited access to clean water and sanitation lead to infection and poor nutrition absorption among masses. And another core cause behind malnutrition is maternal health and gender inequality. So malnourished mother can often give birth to low weight babies, and which cause perpetuating intergenerational malnutrition. So unhealthy mother give birth to unhealthy child, and which generates intergenerational malnutrition. Then what is the significance of addressing malnutrition? So by addressing malnutrition we can protect demographic dividend and prevent an estimated 3 to 4% of gross domestic product GDP due to poor health. So we, by addressing these kind of malnutrition we can gain the advantage of our demographic dividend and can gain 3 to 4% of GDP due to poor health. Next one is reduce healthcare costs. So if we take care of our healthcare, it will ultimately reduce the healthcare cost. So lower expenditure on diabetes, heart disease, and other chronic illness. So by adopting a good and healthy lifestyle, we can reduce healthcare cost and lower expenditure on diabetes, heart disease, and other chronic illness. Address double burden. So tackle both undernutrition and obesity through school intervention. So through school intervention, we can generate awareness amongst children and adopting and help adopting better nutritional habit among students. So from school level, school can tackle both school level can provide better knowledge about nutrition and obesity. So by addressing this kind of malnutrition, we can improve learning, and better nutrition can enhance brain development, memory, and academic performance. So better nutrition enhance brain development and memory and academic performance. So due to which a lot of students becomes successful and become later on become successful scientists, engineers, and serve in another field. And by addressing this, we can reduce rural urban gap and ensure equitable health outcome nationwide. So, what is the key challenges of this? So, aggressive marketing of ultra processed food. So, unregulated promotion of ultra processed food and sugary drink is a major challenge. And sedentary lifestyle and increased screen time and reduced physical activity is another major hurdle. And next one is implementation gap. So only about 50% children in 6 receive complete Anganwadi service. So due to lack of papers and another issues and another physical food grain availability issue, only about 50% of children under 6 receive complete Anganwadi services. And low nutrition literacy. Schools lack practical nutritional education. So we should we should we should engage nutritionists at maximum weekly or in a month nutrition classes. So awareness about nutrition and why we should stay away from ultra processed food. These kind of awareness can be generated amongst students. And infrastructure deficit. So many schools lack playground and nutritional garden. So playground and nutritional garden can act as a pull factor pull factor among students. So student can incorporate a healthy and good dietary habit and better nutrition in our in daily school life. So in lifestyle. So the many school lacks playground and nutritional garden, due to which student students spend lots of time during smartphone and staying away from field. So what is way forward? How we can tackle this? So first of all, ultra processed food free school zone. So ban sale on advertising of ultra processed food and sugary drinks around a school. So this is a major commendable step. So government should ban and sale and advertisement of ultra processed food and sugary drinks around schools. And then practical nutrition education. So teach food label reading, healthy cooking, and nutrition skills to students so that a student can inculcate or incorporate better nutrition lifestyle in their lives. Strengthen PM-POSHAN. So we should must inculcate millet, pulses, wild seed, fruit and vegetable as per dietary guideline for Indian 2024. And we should promote physical activity and make sports and exercise compulsory in a school, which further enhance students' cognitive skills and memory retention. Expand food fortification. So fortified rice or wheat can address micronutrient deficiency. So we should we should encourage food fortification, and governments of India should give its uh, give its aware generate its awareness among masses. Now integrate nutrition program with Swachh Bharat mission and Jal Jeevan mission under water sanitation and hygiene. So government should incorporate and schools should incorporate better nutrition and cleanliness habit, example Swachh Bharat Mission and Jal Jeevan Mission. Under Water Sanitation and Hygiene vast program. To conclude with, we can say projected rise of 44 crore overweight adult by 2050 highlights the need of redefine nutrition beyond calorie deficit. So, various agencies projected that the rise of overweight 44 crore overweight by 2050, and the agency highlighted need to redefine malnutrition beyond calorie deficiency and transforming school into preventive healthcare center, improving nutrition education and ensuring convergent governance can help eliminate thin fat phenotype and build a healthier generation. So, thank you for attending today's session. Please read this article very carefully, and we have highlighted the most important point of this article for important data and facts. And after attending this session or reading this article, please attend this please attend this PYQ. This will give boost to your preparation. And thank you for attending today's session. For complete PDF, please visit our website, and for further preparation, please visit our website and YouTube channel. Thank you.